Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hi, everyone. Welcome to AFSPA Live, the live video broadcast Q&A session that we stream every last Thursday of the month, normally, at 11 a.m. Eastern Time. My name is Maddie Norton, and I'm excited to be moderating the show today. I'm a communication coordinator at AFSPA, and today we are discussing mental health resources for the holiday season. And joining us today, as always, is CEO Kyle Longton. How are you today, Kyle?
Hey, Maddie, I'm doing great. And I don't know if everybody can see it, but we did decide to sort of brighten things up. I'm decked out in my bluey holiday wear. You've got the reindeer.
We do.
So because I actually missed, we had a holiday sweater party at the office, and I was there that day and didn't wear my sweater. So this is my makeup day.
Right. This is our makeup day because I was there too, and I didn't have anything festive.
Yeah, we were too professional.
Right.
Yep.
Right.
Okay. So, well, and you know, I just want to say we talked about this because this topic, the mental health resources, because the holidays can be a challenging time for a lot of people. You know, it's we think of it as like a celebratory time, and you're getting together and giving gifts, and maybe you're going to see family, but that can be a challenge for a lot of people. And so we wanted to take this opportunity, and you and the team suggested this and put it together to make sure people know that they've got support available.
Right.
But I will say one thing we cannot do today, because neither of us is qualified, is answer questions about specific mental health symptoms or needs. Our goal today is to give you some resources to help you through the holidays or even for long-term support. And we'll be sharing those today. But I think you said we had some questions that we received ahead of time.
We do. We have a couple of questions, and I'll throw off or start with a little lowball one. What is the difference between telehealth and telemedicine?
I'm really glad we brought this up because there was some, I don't think it's too much to say panic among some members and even some of our partners about our announcement that we are changing our telehealth provider for overseas mental health needs. And that's moving from V-Health to Lyra Health starting January 1. So for us, for a foreign service benefit plan, telehealth means a virtual visit with our designated vendor. So if you're in the US, that's Teladoc Health. And that's for general medicine, virtual primary care, mental health. And actually, we've seen mental health outpace general medicine in the last year in terms of what people are using the service for. You can also use it for dermatology and nutrition counseling. Overseas, telehealth is currently through V-Health worldwide. That's actually backed up by the Teladoc International resources for general medicine consultations and for mental health. The mental health, as I said, is changing January 1 to Lyra Health. And then globally, members have access to Maven Clinic as well. And all of these, the telehealth programs are available to members at no cost and without limits. Now, some of them do with limits in terms of the number of visits. There are, in many cases, limits in terms of some of the programs are only available to adults. Age 18 and older. So check those specific programs if you need to, but that is telehealth. Telemedicine is a virtual visit with any other provider outside of those vendor partners. So when I have a virtual appointment, as I did a couple weeks ago with my endocrinologist, we meet quarterly, one time a year I go in person, the other 3 I see her virtually. That's a telemedicine appointment. If in on today's theme, if you have an ongoing relationship with a mental health professional, maybe you're seeing them monthly, weekly, whatever the frequency is, and it's outside one of our vendor partners, that's a telemedicine visit. And Foreign Service Benefit Plan covers telemedicine visits the same as we do in-person visits, which means subject to the calendar year deductible and the coinsurance, and it's based on the provider's network status. So if you're seeing an overseas provider through a virtual visit, telemedicine visit, they're considered in-network. In-network provider stateside, in-network. But if they're out of network, even if you're overseas, but the provider's in the U.S. and they're out of network, we're gonna cover that at the out of network rate. So I hope that provides some clarity. We had some particular questions about one of our biggest partners, Truman Group, which does mental health services focused on expats. So a lot of our folks overseas were asking about that. Still covered. Still, you can still get services through them, and in fact, I think we'll aim to have them either on AFSPA Live or an AFSPA Talks episode early in the new year to talk about their services. So I hope that provides some clarity. We're not changing telemedicine. The only thing that's changing in this area is our telehealth provider overseas for mental health next year.
Right.
Answer to a brief question, but I hope it provides some clarity.
Yeah. And to kind of go off of that, just to clarify, even more, we got a question from a member asking that they do live overseas and they want to start seeing a therapist through telehealth visits. They found one in Virginia. And then they had a question that are telehealth visits in 2025 only covered through Lyra Health? And then they said, will we no longer be able to see or to use US-based providers for mental health telehealth visits outside of that app?
Yeah. So that's a great question. That's exactly what I hope we can clarify today is that no, the Lyra Health is available and it can there's resources you can call sort of for an immediate need. They can provide some ongoing assistance if that is what you want, and they will pair you with it's only for overseas. They'll pair you with an English speaking provider who's licensed to provide services in the country where you're resident. However, as this member has asked, if you'd like to start a relationship, a telemedicine visit, and so I just want to be clear, that's what this member is talking about, would be a telemedicine visit with therapists in Virginia or wherever they might be in the United States or outside of the app. That is covered, but it is covered the same as an in-person visit would be. So you found this provider, you want to continue seeing them, and as long as the provider is willing to provide those services. So sometimes providers may be hesitant if they're in the U.S. and you're overseas to provide those. Sometimes they're fine with it. Right. So that is up to the individual provider. We will cover it, subject to establishing medical necessity, et cetera. But we will cover those visits. Mental health, we'd cover it again based on the provider's network status.
Got it. And then a question that, is common because, telehealth is a new thing. What is the difference between telehealth and then in-person therapy?
Yeah. So I will just talk about virtual visits generally, whether it's through telehealth or telemedicine, whatever it is. But I will say I personally have done both. And in some cases, it's just a matter of convenience. Right. It can also be a matter of access. So, the person from the last question, they don't have access perhaps to mental health provider where they are overseas, but they can get someone stateside. So I think in this case, we should be clear. We're talking about what some might term talk therapy. This is counseling. Mm-hmm. And it's provided through a HIPAA compliant secure platform. They're going to ask you questions. In a lot of cases, they're going to want you to be on camera rather than just over the phone so that they can read those reactions and you can see them. But I think it depends on what you're seeking treatment for and the form of treatment that the provider specializes in, whether it's cognitive behavioral therapy or some other form. But for the most part, it's just there's not a difference in coverage if we're talking about telemedicine versus in person. Right. And so you link up with them, you go through, they talk through, they may make recommendations or push you to delve deeper, but that's what we're talking about. Very, very similar approaches.
Right. And I think, and it's not to say that like one is better than the
Yeah,
other. It's obviously just like whatever works for you. Like Kyle said, I too have done both. And sometimes it's easier to talk in person than it is through a computer screen. And a lot of times it's also just like the access to having telemedicine visits is just a lot easier
right.
than driving somewhere or having to, take time of your day when like you can just log on, speak with a therapist, and have your appointment.
Yeah.
So it's really all just about you because either way, you're getting the same care, just virtually versus in person. And so it's really just up to you and what you think is best for you. Like Kyle said, how there's different types of therapies that may work differently. I know like EMDR is different, where you would need to be in person versus virtual, things like that. So just wanted to answer that just in case people weren't aware. Um,
Yeah,
and then,
I'm
oh,
sorry,
go
I'll
ahead.
just use myself as an
Yeah,
example. I live technically in suburban Maryland around Washington D.C., but where I am is way out. And we do have a physical therapist and a dental office in town. And actually, I guess there is a doctor, but they don't accept new patients or insurance. So
right.
there's nothing in my town. And the nearest provider who's in network with our insurance is a half hour's drive away. And to do
Yeah,
that in the middle of the day means taking 2 hours off of work to drive there, to have the appointment, and then to drive back and then try to get
right.
back into work. It can sometimes be easier. It can also mean that we run into this question, there's nobody in network, or you might be able to find somebody elsewhere in the state who's willing to provide services through telemedicine, who's in network but maybe not conveniently located for in person, just as you were saying.
Right. And I think that's a perfect segue into our next question. How can I access mental health services in a different state or country if I'm traveling or relocating?
Sure. And some of that is through the tele health options that we offer. So if you're looking for that, you can, stateside, if you're talking about going from state to state, Teladoc Health will provide you options for providers who are licensed in the state where you're located. That they and they're very, very strict about that within their platform. If you're overseas in 2025, Lyra will connect you with a provider who's licensed to perform services in the country where you are. Beyond those telehealth options, if you want a relationship with a provider, or you've got a relationship with a provider and they're willing to continue that relationship virtually as you go overseas or excuse me, move to a different state, you can do that. You can also search to see in the provider search tool for FSBP to see if providers are willing to do telehealth, telemedicine. That doesn't necessarily mean they'll do it across oceans or across even state lines, but at least shows that they may be open to that. So some of this is just developing that relationship with the provider and seeing if they're willing to continue it, especially if you're going overseas.
Absolutely. I was going to try to find that provider link, but if you go to our website, oh, here it
Mhm.
is, provider search tool, aspa.org/FSBP/providers. And that's where you can go to find. And there's so many filters too. So you can specify exactly what you're looking for, where, and things like that. So definitely check that tool out if you're looking to see who's available to you in your area or not.
Right. And I will say that Teladoc and to an extent, I'm still learning about Lyra to a certain extent, but they do offer the option for you to sort of go in and find, for instance, if you prefer a counselor of the same gender or somebody maybe at the same stage of life or something like
Right.
that,
Yeah.
you can identify that within those telehealth platforms as well.
Of course. And that's such a good point too, because I totally forgot that there are different therapists for different, uh, like you were saying, different stage of lives. Like
Mhm.
therapists specialize in certain areas. So that tool also helps you
Yeah.
hone in on what exactly you're looking for if
Right.
you're dealing with whatever anxiety, depression, life changes, things like that.
And in the US, tools like Psychology Today can be helpful also in doing a search and finding about the specialties where different counselors and therapists,
Right.
what their background is.
Yep. And I think that website even shows you like different reviews from different people too, who have been like, hey, this was a lovely experience. So definitely check that out if you're trying to find one, and you just don't really know where to start. Because it can be a lot to, dive in and where to go. And we don't want you to think that it's a hard process to get into, because it's definitely not. It's a very simplified, easy process, and but it can be hard to take that step. I
Right.
definitely think.
And find the right fit sometimes, especially if
Mhm.
you're looking to address something that you think might be an ongoing conversation, ongoing
Right.
treatment.
Exactly. And I think that it's totally normal to meet a therapist and maybe you guys just don't vibe well, or, that's just not the right fit. It is totally okay. And as you would a normal primary care physician, to try someone else,
Yeah.
because it's all about getting the care that you need and the care that you deserve too.
Yeah.
Because as we say around here, your mental health is just as important as your physical health, and they coincide with each other. So, keep that in mind. But I would love to ask, what resources do we have that are available for people who are struggling with specifically substance abuse and mental health disorders?
Yeah, so we have, I mean, we have the benefits that we've talked about in terms of accessing telehealth or telemedicine or in-person visits, whether they be in-network providers or out-of-network providers. We also offer a number of other resources that our members may find helpful. For instance, My Strength. We've had a partnership with My Strength for almost a decade now, and this is a sort of a self-guided app. It's now part of the Teladoc family of solutions, but it started out as its own company. But you can go into My Strength, and this is available for people age 13 and up. So it is available for teens to use. And as I said, it's self-guided. It can help you with things like substance use, like anxiety, depression. There's a number of different ways that you can approach this, and it's at your own pace. So if going in for sort of a daily exercise, daily affirmation is your thing, go for it. If you want to work through different modules, they have those excuse me, as well. That's a good one. Maybe especially if over the holidays you find things are a little too much, I need a little support. Start here. This is a great place to start and see if you need more, and you can explore that maybe after the holidays when you're more settled back home, whatever it may be. We also have a program called Able To. And this is specifically for, I should mention, My Strength is available worldwide. Able To is only available to members age 18 and older within the United States. It's physically located in the US. And this is intended for people who are facing sort of a major change in their life. So maybe it's the loss of a loved one. Maybe it's, I'm going to put this out there, the birth of a child.
Right.
Joyous event,
Absolutely.
but hugely
It's a
disruptive.
lot.
I'm not trying to scare some of our colleagues who may or may not be looking at this possibility soon, but can be disruptive, and you're focused so much on this tiny human that sometimes you lose yourself. So a way to focus on can also be dealing with a major. I actually engaged in Able To myself when dealing with a chronic illness
Yeah.
diagnosis. Can also be the loss of a loved one or
Moving across the country,
there's a
across the
lot of
world.
ways to
Yeah.
engage in this. So, but it is available. It is intended to pair both counseling, so treatment and coaching at the same
Yes.
time for about an 8-week period is the intended period, and it does. I've talked with people who've used this and myself. Very useful. There's an app that goes along with it, and ways to engage between visits and so forth. So this is a great option that people can utilize again to pair sort of a self-guided piece along
Right.
with mental health coaching and treatment. And speaking of mental health coaching, we also did a great episode on mental health coaching with our partners at Teladoc Health. I'm putting everybody on the spot to see if we can find that, but if you go back in I believe our podcasts, you can find that. And I think we did an AFSPA Live episode as well. I know podcast for sure, but you can find that
Yes.
information and a lot of other resources and tools that we discuss in depth, including My Strength. And Able To in the AFSPA Talks podcast for the My Strength, and Able To go back to the very beginning, back to 2021.
Right.
Unfortunately, Maddie's not on that one. It's mostly just me. But tune in and you might find something at least to learn a bit more about those programs.
Right. And also, if you're a visual person, you maybe not into podcasts, don't you worry. We have our YouTube page, and it is just an encyclopedia worth of knowledge and things that you can learn from past podcasts, past AFSPA Live episodes, because if you weren't aware, they are all on our YouTube page, YouTube/AFSPA Cares. We got a great comment the other day saying that they didn't know we had all of these videos and that they've been great to learn about different programs we have. And that was so great to hear. That's why we do them. That's why we do live, just to make sure that, members are being heard and getting their questions answered. I would love for you to, go ahead.
I was just going to mention one other resource that it's not specific to FSBP. It is available nationwide. It is the 988 helpline. And you can see it scrolling on the screen there. You can call 988 from a phone or go to 988helpline.org. If you're in crisis, or if you as well find that you may be dealing with somebody who's in crisis, someone in your family, a friend, something like that, you can give them a call. On the website, there's also information on the Here to Help hotline, as well as the National Suicide Prevention Lifeline. Those can all be reached by calling 988. So again, if you find yourself in need of those services and facing a crisis, please make use of that resource.
Absolutely. Absolutely. If you, like we said, during the holidays, may not be staying at your normal place and, just get overwhelmed. We have so many resources that you can reach out, including 988, just to talk it through, talk yourself down sometimes can be the way to feel better. And we have that resource there. So be sure to check that out. But I would love, Kyle, if you could go back a little bit to talking more about the difference between counseling versus coaching, which I know we've done a podcast episode about, but that, some people may not be aware.
Sure. And I would point people to the podcast
Right.
just for more in-depth information. I would say counseling is going to be provided by somebody who is licensed and certified in mental health counseling. So typically we're talking about a master's level counselor, or could be a psychologist. In some cases, it may even be a psychiatrist who's pairing that along with physical medical treatment, including the possibility of prescription medications to supplement therapy. And that in that case, somebody may be walking you through and applying various techniques, such as we talked about before, cognitive behavioral therapy. Maddie, you mentioned another one that has it's
EMDR.
Thank you.
Yeah.
I admit lost it. And so they are trained. They're going to walk you through and take you through perhaps your history. They may be talking about a traumatic event in the past. They may be talking about episodes that are happening more regularly in terms of anxiety and stress, and trying to delve into the causes of that and equip you to understand your reaction. Coaches, very useful, but they may also be talking about how to equip you to handle those events when they come up. So not so much to understand the cause of them, but how to address them when they arise. So if I have a family member who sometimes gets very anxious, and so a coach might give you some strategies when you're starting to feel that way. How can you take a moment? How can you tune into your environment, ground yourself?
Yep. There we go.
We did not plan that.
Nope, we didn't.
But we go through an exercise in my house where what's 5 things you can see,
Yep.
4 things you can touch, or 3 things you can hear.
Here.
2 things to smell and 1 to taste. And we do that daily sometimes, and it just takes you into the moment, I think, really, and into your surroundings and out of the episode you may be experiencing. So I think that's where the coach comes in, where they're going to help you, give you strategies, help you understand maybe even what might be triggering those at different points. Whereas and doing both at the same time may be effective. Doing one or the other, depending on what your needs. A counselor may say, hey, actually, you need coaching. A coach may say, let's pair this with some counseling. And so don't be afraid to ask, is this the right level? Do you think I need to step up, step down when you're dealing with a mental health professional?
Absolutely. And, we're getting to almost 11:30. So I thought we could talk a little bit as we said at the top of the episode, we are not mental health professionals. We are not doctors. And so do not take this as licensed advice, I would say. But we have lots of blogs. We've told you about the resources on the website, our podcast. But we did get to ask a question about, what are some tools for managing mental health during the holidays or other stressful times of the year? And so Kyle gave a great example with the grounding technique. And so I would love to just talk about a little bit about, especially being around family, or even if you, especially I think during the holidays, the loss of a loved one can be hard when you're celebrating with others and not having that person around. Set boundaries for yourself. If you know that you can't handle extended amounts of time with your family, or, even just situations like that, take the time to be like, I've had enough. I'm going to go do something by myself. Take time for self-care activities, whether that's reading, going for a walk, coloring, whatever it may be, to get yourself kind of out of that moment, or just wanting some stress relief. Look towards that. We have a self-care blog I know that we did a couple of months ago that you could look at for ideas. And just know that, your feelings are valid, and it's okay to kind of work through them regardless of what others may feel. But just, try to keep in mind that at the end of the day, there's only one you, there's only one body, one mind. And you should always, try to make sure that you're okay. And if, like we've talked before, if you know someone who is in crisis, or maybe having like an anxiety attack or things like that, we have so many options for you. And I can say that, if you're being that person, being there for someone, just listening, hearing them out, ask if they want. I know I ask my family a lot, do you want solutions, or do you just want to be heard?
Yeah.
That can be really helpful, because sometimes you just need to rant, or you just need to vent. And that's okay. Reach out to people that you feel safe with. Reach out to people who may not be there with you physically, but, you can text, call, take the time for that, because, we've talked lots about family, but family isn't just blood all the time. It can be whoever you want it to be. So I hope we keep that in mind. And Kyle, if you have anything to add.
Well, I'll just say, I think a lot of times we approach the holidays also with a lot of expectations. And if we don't have that, both good and bad,
Right.
and so it's like, oh, we're going to do this again. And in fact,
Right.
maybe people have changed. Maybe they lighten up. Maybe they heard feedback before. It could also be
Absolutely.
somebody else's expectations that, we've got to have this particular dish, even though only one person eats it.
Right.
Or, all the presents have to be wrapped perfectly. And or we can only do it on this specific timeline. I've run into that. And families change, families evolve, schedules change. You might be bringing new people in. You might be going somewhere else. You might be the new person.
Right.
And it's okay. I think what you said about drawing boundaries is so important. And I think also just grounding yourself in a routine sometimes too. Like, I'm big on, I need to take a moment out. I'm going to go do the dishes.
Right.
Um,
Oh my gosh. Yes.
it's and then I'll listen to something, or
Hmm.
watch my nobody wants to watch Muppet Christmas Carol with me.
I
Um,
love Muppet Christmas
Right?
Carol.
It's the best one.
So good. So good.
Trying to pull my kids into it this year,
Yeah.
but like just something like that. Like, this is something that I love to do, and if I have to do it by myself, that's okay. I can do it while I'm,
Absolutely.
doing the dishes, or taking the dog for a walk, or something like that. Getting out into nature. Even, I know we do a lot of this time of year, like helping somebody else.
Right.
That's something that you can continue throughout the year, and it's okay to do that to get a good feeling for yourself, because everybody's going to benefit in that instance. So I appreciate this conversation. I know that I sometimes just take a time out and say, all right, I'm going to
Right.
bed early. Pull out a book, like you said, or
Hmm.
because it's a little cold sometimes to
Go for a walk.
go for
Yeah.
a walk. And
Depending where you are.
I joke sometimes, and I say I'm putting a shield on. It's the
Right.
son or son-in-law shield, and that's okay too.
Right. Exactly. Taking the time, like you said, putting on a podcast, putting on a video, whatever it may be, that's what matters. And just drawing that line, because, you don't want to, no one wants fights or anything like that. So just, taking the time to be like, I know I need to remove myself from this. What else
Mhm,
can I do to calm down, ground
mhm.
myself, whatever that may be?
Yeah.
But yeah, so let's see, making sure we don't have any other questions. Otherwise, this was our last AFSPA Live of the year. Crazy to say, next week is Christmas and, Christmas Eve and everything, and then New Year's.
And Hanukkah starts on Christmas Day this year.
Oh, wow. Look at that. I hope that everyone has a good holiday. And we will be back with our new episode January 30th on the last Thursday of the month, as usual, on at 11 a.m. Eastern Time. And we are so excited to start the new year out. Look out for some podcasts too. We're going to try to get some out. And otherwise, we hope you enjoy your holidays. We hope you had a great open season as well. If you're a new member, welcome.
A lot of them this year. A
Right.
lot of new folks. So if you're watching for the first time, welcome.
Yes, we are excited to have you here. We do these every month. And like I said before, you can find any of the podcasts we talked about, any of the videos, all at youtube.com/AFSPAcares, which is here. And then obviously check out our website, AFSPA.org. You can find the mental wellness resources by going to the wellness link on the drop down thing, and then mental wellness will be in the right hand side, and that's where you can find My Strength, Able To, and all of the other resources that we have for you. Otherwise, thank you for joining us, and happy holidays.
Happy holidays, everybody.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.